Kirby Thompson, licensed naturopathic doctor and acupuncturist, owner and operator of Wildflower Wellness. And today we're here for Dr. Kirby's Pick, August 2020. Now, we have taken a brief hiatus from Dr. Kirby's Pick because Dr. Kirby needed to rest. However, we are back and ready to go for today's topic, which is hydration. Now, I always think of these topics because they are big in the community or big in the clinic. But I had a friend, now this friend is older, 70s, and I asked her, why do you always have bladder and kidney problems? She said, and I quote, because I never drank water and I always held my urine for most of my life. I was too busy to worry about it all. At that moment, I knew that I had to take my turn to speak with you about hydration, right? So, most of the time when patients come in the office, and I ask them, I say, how much water are you drinking? The answer is 8 to 9 times out of 10, not enough, especially when they're first coming in. Now, water and hydration is one of the essential determinants. What is an essential determinant? Essential determinants are the things that are essential to determine your health. If you do not do these things, your life will be either more miserable or shorter than it was originally intended. Let's go over all those things. The essential determinants, the things that determine your health, are breath, breathing, and there are techniques to breathing, and I need to breathe right now. Water and hydration, the topic of today. Sleep, nutrition and digestion, and rest and recreation. Rest is also one of the most ignored things that I often see in the clinic, but that is the topic for another day. So, hydration is defined as the process that causes something to absorb water, right? Water's absorbing into our bodies. Also defined as the process of replacing water in the body. So I'm going to go through some facts and figures later, but remember, without water, it's going to be really hard for you to get waste out of your body and for new, wonderful nutrition to come into the different parts of your body. Remember, blood has a high component of water. Cells has a high component of water. But don't let me get ahead of myself. Your body is 100%, right? Body's 100%. Up to 60% of that can be water, depending on whether you're male or female. That is over half of your body. You have to put that back in. 2/3 of the body water is intracellularly, meaning it's inside the cells, right? It makes cells big. If you don't have enough, they get small. Then remember, there's things going on in that cell. So if you can't get those things done, it's kind of like trying to swim in a pool that has no water. What happens when you dive into a pool that has no water? Let's not talk about it. It's sad. We had enough stuff sad going on around here. Let's make it good. Okay, so let's talk about some of the functions of water in the body, and then at the same time, I will mention some conditions that are associated with that. And I really think if you listen to this, you'll get a really good idea of your condition and how important it is for you to be drinking water. So, number 1, helps form saliva. Remember, saliva is one of the first parts of enzymatic digestion. So, if you have any digestive problems, saliva. It also helps keep the mucous membranes moist. Now, mucous membrane, what's that? That's the lining of literally most of the body on the inside. There's mucous membranes in the lungs, digestion, bladder. Those are very common. And without water, those are not going to be moist. What happens when you're not moist and stuff is moving through? Friction, right? That's so not good for you. So hello, sinus infections, gastrointestinal disturbance, bladder disturbance, increased risk of infections, including in the sinuses. Very important for water. It also flushes the body of wastes. Ready? Kidney, bladder, bowels, liver. If you're having any problems with any of that, blood, you need to make sure you're drinking a lot of water. Lubricates joints. So if you have joint pain, what do you need to be doing? Number 1, easiest thing to do, drinking water. Water is a major component of many organs of the body. Let's talk about that. The brain is said to be 79% water. The heart is said to be 73% water. The lungs are 83% water. The skin is 64% water. The muscles are 79% water. If you go for a workout and you don't have enough water, what's going to happen? Or if you want to look buff and you're not having enough water, what's going to happen? It's not going to look great. Kidneys, 79% water. And bones, a 31% water. So even your bones need water. Remember, brings in nutrition, takes out waste. Okay? So, there's more. Water is needed by the brain to manufacture hormones and neurotransmitters. So, hormones and neurotransmitters, what's that? Well, it can affect menstruation, depression, anxiety, panic, menopause, problems with anything, right, related to hormones and neurotransmitters. Now, can it be a cure-all? In some instances, it can help symptoms a lot. And some not. That's why it is important to make sure that you are getting your totality of your problem addressed by your natural health care provider. And if you don't have one, hold on. We'll tell you how to give us a call at the end of the show. Okay, number next, regulates the body temperature. So are you too hot, too cold, sweating? Do you have hot flashes? Right? Drink that water. Helps convert food and components needed for digestion. What does that mean? That means converting components needed for digestion. If you can't put something dry in the washing machine without water, it's going to churn, right? And if you don't have water to push it all down, what do you get? Reflux, right? I've had people, and they just start drinking enough water, reflux goes away. They usually have a pretty good diet, though. Okay. It also helps deliver oxygen all over the body. Hello, fatigue. Your body has to have oxygen in order to have energy. I mean, that's how it functions. And so if you're not drinking enough water, you have an increased risk of fatigue. I know a guy, he said he used to drink coffee at 3. Now he drinks 20 ounces of water at 3, and it actually gives him more energy than the coffee. But remember, coffee is dehydrating. So, water is for use in transportation of nutrients, minerals, and chemicals in the biological processes, including carbohydrate and protein transport. So, electrolyte issues, deficiencies, detox problems, and the list goes on and on and on. So, as you can see, nothing in the body can be adequately done without proper hydration. So, let's go over a few other things that we did not cover, just because I want to mention it, because it's important. We talked about lungs, talked about digestion, talked about bladder. Pain, I like to mention it again. Water is very important for pain, but the heart. The heart, this is a quote from a resource. Dehydration is known to cause excess strain on the heart. As the heart needs to start working harder to pump the blood through the body, the rise in blood pressure and increase in heart-related strain can be another potential trigger for a heart attack. So, heart attacks can be triggered by dehydration. And I did in my board's review for my NPLEX, for my naturopathic license, I actually, Dr. Paul Anderson said that it was either top 5 or top 10 causes of triggers for heart attacks was dehydration. I was like, oh my goodness, we didn't learn that in school. So, and I went and researched it and looked it up. It's true. Dehydration also causes increased retention of sodium in the blood. Increased retention of sodium in the blood, water follows sodium. What is that going to do to the vessels? It's going to increase their pressure. You have to have water. And most blood pressure medications are dehydrating. So it's very important for you to get enough water. Another one that we didn't talk about is kidney stones. Remember, that's a detox organ. If there's just a lot of crud going in there, in that kidney, and if you're not having anything to flush it out, what's going to happen? It's going to build right up. Water, water, water. So, there are some other, issues that are associated with dehydration. Let me go over a few that we did not cover. Electrolyte imbalances, adrenal issues. People with diabetes actually tend to be more dehydrated. In Chinese medicine, diabetes is called wasting thirsty. So it's really important for you to drink enough water. Like I said, some prescriptive medications cause the body to dehydrate. Make sure you check with your prescribing physician to see if this is something you need to be doing, adding water to your health plan. Now, there are some conditions where you do need more water. Diarrhea, fevers, excessive sweating, increased urination, like I said, medications, but there are also other things that can cause that. Heat injury, and seizures. Now, how do I know if I'm dehydrated? There are symptoms to look out for. Some of them are the exact same ones we were talking about before, like reflux. Constipation is a big symptom for dehydration. Oh, how can I forget headaches? One of the top causes of headaches is dehydration. But let's look at some others. Thirst, extreme thirst, decreased urination, dark colored urine, fatigue, which we discussed earlier, even dizziness can be, hydration can be a factor. Frequent illness, constipation, talk about that, poor skin. Remember, skin is 63% water. If you don't have enough water, it's going to dry out. So if you have dry skin, are you drinking enough water? That's the first thing you look at. Sugar cravings. I know if I'm dieting, sometimes I can drink 20-ounce glass of water and it goes away. Perfect. Electrolyte imbalances, dry eyes, decreased muscle mass. Remember, we talked about that. Intracellular fluid is of the cell is 2/3 water. 2/3 of the water goes inside the cells, including muscle cells. So if you don't have enough water, it's not going to be, fluffy. So remember, drink water to pump you up. Digestive issues, talked about that. And one of the ones, premature aging. Remember, water takes out waste, brings in new. You want new to stop aging. So the question is always asked, how much water do I need? Well, it is said that you should be drinking 1/2 your body weight in ounces of water to maintain hydration. You should be drinking 1/2 of your body weight in ounces to maintain hydration. Now, for some people that will be more. You work outside, you're taking medications, you're doing all this stuff. And some people, it could be less depending on your medical condition. Again, anytime you make change to your health protocol, you need to check with your natural health care provider. Now, remember, if you're making changes to your health and wellness protocol, make sure you check with your naturopathic health care provider. And if you don't have one, please give us a call or visit us online at www.wildflowerwellnessllc.com.